Question 1. A nurse is preparing to administer albuterol via meter-dose inhaler. What instruction is most important? A. Shake the inhaler before use. B. Hold breath for 2 seconds after inhaling. C. Exhale quickly after inhalation. D. Take the medication before bedtime. Answer. A. Shake the inhaler before use. Question 2. What assessment finding in a patient with pneumonia should be reported immediately? A. Dry cough. B. Decreased breath sounds. C. Fever of 101 degrees Fahrenheit. D. Respiratory rate of 12. Answer. B. Decreased breath sounds. Question 3. What should the nurse do first if a patient develops sudden stridor after extubation? A. Call the rapid response team. B. Apply nasal cannula oxygen. C. Encourage coughing. D. Administer albuterol. Answer. A. Call the rapid response team. Question 4. Which respiratory therapy device delivers the most precise oxygen concentration? A. Nasal cannula. B. Simple face mask. C. Non-rebreather mask. D. Venturi mask. Answer. D. Venturi mask. Question 5. A patient is prescribed isoniazid for tuberculosis. Which lab value should be monitored closely? A. BUN. B. ST. C. Creatinine. D. Hemoglobin. Answer. B. AST. Question 6. A patient with a new tracheostomy is unable to speak. What is the nurse's best action? A. Ask yes/no questions. B. Reassure the patient they will adapt. C. Encourage deep breathing. D. Increase oxygen flow. Answer. A. Ask yes/no questions. Question 7. The nurse notes paradoxical chest movement in a trauma patient. What is the likely cause? A. Tension pneumothorax. B. Flail chest. C. Hemothorax. D. Pulmonary embolism. Answer. B. Flail chest. Question 8. Which patient should the nurse see first? A. Post-op patient requesting incentive spirometer teaching. B. COPD patient with oxygen saturation of 88%. C. Asthma patient needing a refill for albuterol. D. Pneumonia patient with productive cough. Answer. B. COPD patient with oxygen saturation of 88%. Question 9. What does wheezing typically indicate in a respiratory assessment? A. Alveolar fluid accumulation. B. Bronchial inflammation. C. Airway narrowing. D. Pulmonary consolidation. Answer. C. Airway narrowing. Question 10. What should the nurse do after administering a bronchodilator via nebulizer? A. Document lung sounds before treatment. B. Have the patient rinse mouth with water. C. Administer corticosteroid immediately. D. Have the patient lie flat for 30 minutes. Answer. B. Have the patient rinse mouth with water. Question 11. A patient with asthma reports using their rescue inhaler daily. What is the nurse's priority? A. Reinforce correct inhaler technique. B. Schedule a pulmonary function test. C. Notify the provider for possible step-up therapy. D. Document current medication use. Answer. C. Notify the provider for possible step-up therapy. Question 12. What is the most reliable indicator that a COPD patient's oxygen therapy is effective? A. Skin color improves. B. Respiratory rate decreases. C. Patient states they feel better. D. Arterial blood gases improve. Answer. D. Arterial blood gases improve. Question 13. The nurse hears a pleural friction rub. What condition might this indicate? A. Asthma. B. Pneumonia. C. Pleural inflammation. D. Pulmonary edema. Answer. C. Pleural inflammation. Question 14. Which finding requires immediate attention in a patient with chronic bronchitis? A. Occasional productive cough. B. Morning fatigue. C. Increased sputum purulence. D. Barrel chest. Answer. C. Increased sputum purulence. Question 15. What is the appropriate nursing action for a COPD patient with thick secretions? A. Apply a warm compress to the chest. B. Restrict oral fluid intake. C. Provide chest physiotherapy. D. Encourage use of opioid antitussives. Answer. C. Provide chest physiotherapy. Question 16. Which lab result is most concerning in a patient receiving long-term corticosteroids for asthma? A. Elevated blood glucose. B. Low hemoglobin. C. Slight leukocytosis. D. Increased potassium. Answer. A. Elevated blood glucose. Question 17. A patient's ABG results are pH 7.29, PaCO 255, HCO3 25. What condition does this reflect? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Answer. A. Respiratory acidosis. Question 18. Which is the most appropriate diet for a patient with advanced emphysema? A. High protein, high calorie small meals. B. High fiber, low fat large meals. C. Pureed foods and thickened liquids. D. Low carb, high sodium snacks. Answer. A. High protein, high calorie small meals. Question 19. Which action helps reduce the risk of ventilator-associated pneumonia, VAP? A. Limit oral care to once per day. B. Maintain HOB elevation at 30 to 45 degrees. C. Administer sedation continuously. D. Avoid turning the patient to prevent disconnection. Answer. B. Maintain HOB elevation at 30 to 45 degrees. Question 20. A patient with a pulmonary embolism reports chest pain and anxiety. What is the nurse's first action? A. Reassure the patient. B. Increase for fluids. C. Elevate the lower extremities. D. Apply oxygen via nasal cannula. Answer. D. Apply oxygen via nasal cannula. Question 21. A patient with asthma receives a corticosteroid inhaler. What should the nurse emphasize after use? A. Increase fluid intake. B. Check pulse rate. C. Rinse mouth thoroughly. D. Rest for 30 minutes. Answer. C. Rinse mouth thoroughly. Question 22. A nurse reviews ABG results. pH 7.36, PaCO 248, HCO3 29. What condition is present? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Compensated respiratory acidosis. D. Uncompensated metabolic acidosis. Answer. C. Compensated respiratory acidosis. Question 23. What should the nurse do before suctioning a tracheostomy? A. Deflate the cuff. B. Provide oral hygiene. C. Hyperoxygenate the patient. D. Remove the inner cannula. Answer. C. Hyperoxygenate the patient. Question 24. Which finding is expected in a patient with emphysema? A. Hyporesonance to percussion. B. Bradycardia. C. Use of accessory muscles. D. Moist productive cough. Answer. C. Use of accessory muscles. Question 25. What is the primary purpose of pursed lip breathing in COPD? A. Strengthen diaphragm. B. Prevent respiratory alkalosis. C. Promote CO2 elimination. D. Increase tidal volume. Answer. C. Promote CO2 elimination. Question 26. A patient has a PEEP setting of 10 centimeters H2O on a ventilator. What is the priority assessment? A. Urine output. B. Blood glucose. C. Blood pressure. D. Respiratory rate. Answer: C. Blood pressure. Question 27. Which patient should the nurse assess first? A. Asthma patient requesting pain meds. B. COPD patient with loud wheezes. C. Post-thoracentesis patient with hypotension. D. Pneumonia patient with 100 degrees Fahrenheit fever. Answer: C. Post-thoracentesis patient with hypotension. Question 28. A patient on a ventilator is restless and the high pressure alarm sounds. What is the nurse's first action? A. Check for a disconnected tube. B. Increase sedation. C. Assess for kinks or obstruction. D. Call the respiratory therapist. Answer: C. Assess for kinks or obstruction. Question 29. A patient receiving oxygen therapy suddenly develops confusion. What should the nurse suspect? A. Hypercapnia. B. Atelectasis. C. Oxygen toxicity. D. Pulmonary embolism. Answer: C. Oxygen toxicity. Question 30. What is a late sign of hypoxemia in respiratory distress? A. Restlessness. B. Nasal flaring. C. Cyanosis. D. Increased respiratory rate. Answer: C. Cyanosis. Question 31. Which intervention is most effective in preventing postoperative pneumonia? A. Early ambulation. B. NPO status. C. Routine antibiotics. D. Daily chest X-ray. Answer: A. Early ambulation. Question 32. A nurse notes dry, hacking cough in a patient taking ACE inhibitors. What should be done? A. Instruct patient to increase fluids. B. Notify the provider. C. Administer antitussive. D. Continue current regimen. Answer: B. Notify the provider. Question 33. A patient with status asthmaticus is not improving with treatment. What is the next likely step? A. Repeat albuterol. B. Prepare for intubation. C. Provide oral corticosteroids. D. Initiate chest physiotherapy. Answer: B. Prepare for intubation. Question 34. What finding requires immediate action in a patient with pneumothorax? A. Chest pain. B. Absent breath sounds on one side. C. SpO2 93%. D. Mild tachycardia. Answer: B. Absent breath sounds on one side. Question 35. A patient with influenza reports fatigue and shortness of breath. What complication is suspected? A. Asthma. B. Sinusitis. C. Pneumonia. D. Dehydration. Answer: C. Pneumonia. Question 36. A COPD patient receives 4 liters per minute oxygen via nasal cannula. What should the nurse monitor closely? A. Blood glucose. B. Urinary output. C. LOC and respiratory rate. D. Potassium levels. Answer: C. LOC and respiratory rate. Question 37. Which test best confirms a tuberculosis diagnosis? A. Sputum smear. B. Chest X-ray. C. Mantoux test. D. Sputum culture for acid-fast bacilli. Answer: D. Sputum culture for acid-fast bacilli. Question 38. What is the priority action after inserting a chest tube? A. Administer pain medication. B. Monitor vital signs. C. Tape all connections securely. D. Obtain a chest X-ray. Answer: D. Obtain a chest X-ray. Question 39. A patient with laryngeal cancer post-laryngectomy is unable to speak. What is the best communication method? A. Lip reading. B. Picture board. C. Call bell. D. Facial expressions. Answer B. Picture board. Question 40. A nurse notes reddish drainage in a chest tube collection. What should the nurse do? A. Clamp the tube. B. Document as expected finding. C. Notify the provider immediately. D. Milk the tubing. Answer C. Notify the provider immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.